This is a special presentation from News Channel 9, WSYR Syracuse.
For some, the days have dragged.
Does it feel like 6 months?
No, it feels much longer than that.
For others, the months have flown by.
Wow, 6 months. I feel like, I have to think about that. 6 months. March 16th.
Some lost loved ones. Others lost jobs. All of us have lost what we used to know.
I kind of believe all things are possible, and I've been writing about it with a lot of other people. This even surprises me.
Events canceled, schools closed, businesses shut down, a different way of life.
You and I have spent a lot of time together in this room. I don't think you've ever sat in one of these chairs, though. So what's it like to be beneath your podium?
It's an interesting look.
Tonight, for the first time, the leaders fighting the pandemic on the front lines take us behind the scenes of the tough decisions they've made along the way. They tell us what to expect ahead and take us back to the dark days. Now 6 months of coronavirus in central New York.
Good evening. I'm Andrew Donovan in Exhibit Hall B of the On Center, which hasn't hosted a wedding or convention in 6 months. That's nearly 200 days. Instead, it's where Onondaga County leaders spoke to the community throughout this coronavirus crisis. Over the next 30 minutes, I'll sit down with those same leaders for brand new interviews to talk about the dark days as they faced tough decisions early on in this once-in-a-century pandemic. December 31st, 2019. Crowds so packed they would alarm us now celebrate the beginning of 2020.
This is where Syracuse keeps its memories. We're going to make a bunch tonight. We're looking forward to it.
Will duly serve.
Ryan McMahon beginning his own new term.
The Office of County Executive
of Onondaga County.
Of Onondaga County.
We just got off really 2019, which is probably one of the best years of our county's history from an economic standpoint.
Tom Brady and Jimmy Fallon visit a jam-packed Carrier Dome.
Jimmy, anything to say to the city of Syracuse?
Oh, come on, I love Syracuse.
Most of us blissfully unaware of what was already on the way.
At the 31st of December, they threw a thing up that said, basically mysterious pneumonia is killing people in China.
We had our first meeting about COVID on January 29th. It was a very small meeting, just saying, what is this?
In January 2020, we put our first order in for, I think, 35 pallets of N95 masks. So I reflect back now and I say I must have been concerned to some degree to ask people to buy 35 pallets.
We were at a conference in Washington, D.C. with my peers from across the country, and that's when the first case was confirmed in the Seattle nursing home in Kings County. And the Kings County executive and I were scheduled to be speaking on an early childhood topic. And he got to the conference, but then had to quickly leave to go back to his community.
McMahon returns to his community too, and holds what would be his first of many briefings.
If you start to see symptoms and you're sick, stay home.
What was your most alarming early moment where you thought to yourself, we're going to be in for a tough ride?
Oh, when the cases started popping up in Westchester. That to me was, this is not going to go well at all.
It was an issue at the worst time, Monday, March 10th. 4 days until Syracuse's St. Patrick's Parade.
As of today, the parade is on.
It is on.
Outside of the landmark theater, crews have already put down the barricades that will eventually line South Salina Street on Saturday.
The county executive keeps pointing to the numbers. Onondaga County has no cases, nor does any neighboring county.
When they were saying, oh, this parade's going to happen, looking at the totality of the information that was available, I probably didn't have any issue with it. But as the days went on, things changed.
Dr. Thomas is watching the cases spreading downstate, well aware of how the flu spreads from there to here.
We have the opportunity for maybe a 10-day to 2-week head start on making decisions that could impact us kind of longer term. Probably there already are infected people in this community, and you put 3,000 people together, on the street and then in the bars, it's just potentially not gonna play well.
Wednesday, March 11th, the struggling Oranges upset over North Carolina. No one knew it would be the last game of the season. The next day, the ACC tournament is canceled, the first of many March events to fall.
Your opinion was sought on the parade.
I don't know if it was provided.
Thursday morning, March 12th, now 2 days before the parade. Monroe and Albany counties confirm their first positives.
Yeah, I was nervous that day. The routine was YMCA, 5:30, read all the information that came over the night before, and then I saw it and I was like, yeah, this is not, we can't do this.
Did you speak to Ryan McMahon that morning yourself?
I did.
Yeah, and what did you say?
I just said, this is what we're seeing, this is how we're interpreting it, this is my concern, this is my recommendation.
Did he seem shocked?
No.
We are going to postpone the St. Patrick's Day Parade due to the data and the information in front of us today.
For the first time in its 38-year history, the Syracuse St. Patrick's Parade has been canceled.
How hard was that?
That was a real bummer. That's a personal event for me and my family that we look forward to every year.
None of it would have happened if those two offices, right, if the mayor's office and the county executive's office hadn't said, communicate with us, talk to us, share your perspective.
So when you have to control transmission in the community, you really have to take bold decision, which may not be very popular at times.
I am not a dramatic person, but I would say that decision was probably one of the best decisions in terms of getting Central New York on a good path. That decision bought us time, right? That decision bought us time.
We know coronavirus was in Central New York the day the parade was supposed to happen.
Absolutely. Absolutely.
The numbers are staggering.
Coming up, the pandemic hits, a fateful phone call to the county executive. The death toll rises, and one regret Ryan McMahon carries to this day. As Dark Days, 6 months of coronavirus continues.
I'll remember that call. I was in my car and I took that and I knew what it was before I answered.
Monday, March 16th.
As of 8:50 this morning, we got our first test case confirmed back in Onondaga County. It is a female in their 70s.
Now it's time to go to work and make sure that we can contain it.
I was very conflicted on should we have closed schools in a different strategy earlier. I was very conflicted with that moment. But I knew if I didn't hold strong, the superintendents would all close early and that kids could get hurt not getting meals.
By the end of the week, the county executive's briefings, now daily and moved to the socially distant on-center, become appointment television, as do the governors.
We're mapping all these cases, we're analyzing them.
They become more important as the virus spreads and people start dying.
I stand here with a heavy heart. We've had our first death in our community related to the COVID-19 disease.
What was your darkest day through this process?
You know, it was tough to sleep every night, to be honest with you, during all this, because you had so much, you're carrying the weight of the world. But I think the worst day of the pandemic for me was the day I believe we lost 4 or 5 people. This is a lot, and it's 5 individuals who have people who love them, 5 individuals who their family members probably didn't get to say goodbye. You know, I won't forget it. It just, when I found out, it was just tough. It was tough for me to stay on top of my game mentally that day. So for me, that was definitely probably the darkest moment.
Sorry. Death of any individual is, that person is never coming back, right? I have As a physician, I have signed death certificates for majority of my life, right? And my patients, when they were ill, they passed away. And it was never easy, but I could hold my patients' families' hand, hug them, send them a card, and all those things. Here I can't do those. It's hard.
I knew, based off of what this virus was doing, that meant we were going to lose more people. And it was inevitable, and we were waiting.
Did you ever consider the possibility you'd run out of beds?
Oh yeah, we did. You know, the R value was climbing, and the number of patients that we had in our hospital was, you know, in the mid-40s. We didn't want to get to the hundreds of patients like some of the downstate hospitals.
Hospitals are filling up, and Onondaga County reserves Manley Fieldhouse as a field hospital.
Dark days, I think, preparing for what could be the worst, right? We all know what the worst could have been. We've all seen it in other parts of the country, in the world, in the state. And that's not something that people, it's easy to talk about, but it's something that we had to be prepared to handle.
Your eyes glazed over a little bit.
It's tough sometimes, yeah.
Between Central New York's largest counties, Onondaga and Oneida, 323 people died, nearly half in state-regulated nursing homes.
I wish I was louder a little bit related to nursing homes early on. We tried very hard early on to get authority to make them do things that they pushed back on. And we weren't given that authority, and we were reminded we didn't have that authority. If I had to do anything, even as loud as I was, and we talked about it publicly here every day, you know, could I have been louder? Internally, I reflect on that.
He did have the authority when it came to other senior housing complexes, and discovered the people who worked at them were unknowingly bringing the virus in.
When we started really pushing out asymptomatic testing into the senior facilities, I think that's one of our proudest moments, because we saved people's lives. We found cases that would have ran through those buildings just like they ran through nursing homes.
Last week I was noting that was the first time we didn't have a COVID patient in the ICU, and we didn't have one on a ventilator. I don't believe we still have a patient right now on a ventilator, which is great.
Coming up, the turning point, the heroes on the front lines, and how Central New Yorkers avoided the worst case scenario.
I hear that everywhere I go. Thank you to Upstate.
At the height of the pandemic, there is no scarier, but also no more inspiring place than the hallways of Syracuse's hospitals.
You know, the nurses that went into the COVID positive rooms with virus all over the place, with courage all over their face and grit, and they went in every day and took care of those patients. They didn't have to have a conversation with me. I saw it in their eyes.
Some take that determination to help another hospital in the SUNY system, Stony Brook, an entirely COVID hospital serving the New York City area.
It was tough to see them go. It was very emotional. And then we did it again. And we did it from our community campus, people from there. And then we ended up sending people that weren't nurses, people that were other technical people that were needed downstate. So it was pretty heartwarming.
Just as much gratitude is owed to Upstate's researchers, who've helped Central New York become a leader in testing.
I talked to some of my peers around the state and things that they are doing. Their counties aren't doing what we've been doing.
It's a ton of work, a ton of pressure. We kept on having things thrown at us that we've never had to do before, but we did it. And I think we can point to that, and I think that was a big turning point.
Most SUNY campuses are now testing their students' saliva and sending the swabs to Syracuse for results.
The more simple you can make it, the more accessible you can make it, the faster, more reliable, and cheaper. That's the way it's going to go, and that seems to be the saliva test. I mean, we're talking about thousands of tests a day that we can do.
But it wasn't always that easy. In the earliest days, nasal swabs and testing chemicals are worth their weight in gold. When Onondaga County first offered testing at the Syracuse Community Health Center, even before there was a single case, nurses are lucky enough to have enough supplies to get through the day.
Those were scary days, behind the scenes where we were doing everything we could, trying to do more, but literally didn't have the resources to do what we wanted to do.
There was nothing normal in March and April. I mean, it was the Wild West. And we were bidding on these crazy prices for things that were, several cents now were, $4 or $5 a mask and $8 a mask. And everybody had a friend who could, get us cheaper PPE. But our materials people had to vet that through. Was it the real deal? Was it some kind of knockoff?
We inspected PPE. We refused it. We sent it back.
So we had PPE flown in, and we were supposed to pick it up at JFK Airport, and when it got there, it was taken, and we don't know who took it.
Stolen or allowed to be taken?
I don't know.
It's going to come back full circle. And when we called some of those organizations that we got test kits from, and it wasn't just governments, it was hospitals, other places. When we called them back and said, hey, you gave us 100, we want to give you back 150, you want them? And they couldn't believe that we were calling and kind of giving that back to them and returning that favor. They helped us when we were in need, and when they were in need, we wanted to make sure that we were doing that exact same thing.
Testing is just one thing Onondaga County suddenly finds itself responsible for.
A lot of our county departments stepped up, and we had DOT workers deliver meals to folks who were in a vulnerable situation that didn't feel comfortable leaving their house at the time. We provide over 500,000 meals across the county.
Proof that those who were spared illness still faced their own problems. Businesses are still struggling. People are without jobs. Local governments have obliterated budgets and need help from the federal government. The state's phased reopening was sometimes just as stressful as it was helpful.
I spent really all night writing emails back to people, many people angry, upset, not so much with us, but just at what was happening. And we tried to be there and be a level of support for them. So you were asking people to do so many things, and there was people that were now vulnerable that needed help, and they needed help in ways that our government just hasn't really been in that lane before. So that was tough, and that was really tough, and that weighed on you, understanding how many people really were in dire straits.
Coming up, mandatory masks. How much longer do we need them? A question we take to the doctors as Dark Days 6 months of coronavirus continues. How long will people be wearing masks?
We're going to be wearing masks until there's a vaccine that is deployed in the tens, if not hundreds of millions of doses, and people in the country get vaccinated.
Will that happen in 2021?
It can. It can. Yeah, I mean, I am not one of the people who thinks we're going to have a vaccine in 2020.
This mask, we should have the name written in there. Mask means economy. Because people can really enjoy life if they can do and keep the restaurants open, keep the shops open. They can go out and hang out with again, some limited grouping, and keep their activity and their emotional health going.
And now we're still in that balance of public health, doing what we know works, at the same time getting our lives back as close to normal as we can.
When they think about their personal rights and wearing a mask and how that may or may not impact their personal rights, that they're actually thinking of, their neighbor or their parent or their grandparent and what that, wearing a mask or washing your hands or decreasing your social footprint, what it's really all about, and that it's not about them. It's about the community. It's about saving each other's lives until we can get a vaccine and get through this.
How would you grade Central New York's performance in the last 6 months?
I don't know whether I should grade it. I think I would say that we have done quite well.
How did Central New York do?
I think we did well. I think we're doing well, not over.
How did the federal government do?
I think the federal government could learn a lot from the state of New York. and from central New York. That's how I feel.
You can't argue with the data, the science. I mean, we did it. We had the same tools that other states did. We used them, and I think the outcomes are pretty impressive.
The community's done a great job together. The community stepped up to stop this virus. The community is what really stopped that worst case scenario from happening.
I think overall, this period of time and those of us who lived in it, history will judge us well.
As Dr. Thomas said, it's not over. Just this week, America hit the grim milestone of 200,000 deaths. That's not just one big number, that's 200,000 American families forever scarred by coronavirus, including the Fagans in Lafayette, who lost their 28-year-old daughter and sister, Adeline, a doctor. Those who haven't lost loved ones maybe lost their jobs or livelihoods. At the very least, all of us have lost the comfort and flexibility our lives used to know. At the 6-month mark, it gives us the chance to reflect on the lessons we've learned, mourn who and what we've lost, and celebrate just how resilient and how strong we can be together. On behalf of photographer Jack Estabrook and the entire News Channel 9 team on the front lines, I'm Andrew Donovan. Good night from downtown Syracuse.